What were the first condoms made from? Imagine stepping back thousands of years to a time when protecting yourself during sex meant using natural materials found around you. The earliest known condoms were not made from latex or rubber like today's versions. Instead, they were crafted from animal tissues and other natural substances. The first documented use of a condom-like device dates back to around 3000 BCE. According to historical accounts, King Minos of Crete used a goat's bladder as a protective sheath during sex. This was likely motivated by a desire to prevent harm or disease, showing an early understanding of the importance of protection, even if the reasons were more myth than medicine. Fast forward to around 1000 BCE, and we see ancient Egyptians using linen sheaths. These linen coverings were probably intended to protect against disease, although their effectiveness would have been limited. Linen condoms were likely uncomfortable and not very reliable, but they mark an important step in the history of barrier methods. During the 1400s, condoms made from animal intestines, especially those of sheep, calves, and goats, became more common in parts of Asia. In China and Japan, people used condoms made from oiled silk paper or lamb intestines. Some Japanese condoms were even made from tortoise shell or animal horn, covering only the head of the penis. These glans condoms were mainly used for birth control rather than disease prevention. In Europe during the 1500s, Italian anatomist Gabriello Falloppio described a linen sheath soaked in chemical solutions, including mercury, to protect against syphilis. This is one of the earliest written accounts linking condom use directly to preventing sexually transmitted infections. Animal intestine condoms, often called skin condoms, remained the primary type through the mid-1800s. They offered some protection against pregnancy and STDs but were expensive and required careful preparation. The big breakthrough came in the mid-1800s with the invention of vulcanized rubber. Around 1855, the first rubber condoms appeared, offering a reusable and more affordable option. Early rubber condoms were thick and comfortable, and sometimes only covered the glands of the penis. By the 1860s, full-length rubber condoms were mass-produced, although they still had significant drawbacks compared to modern versions. The introduction of latex in the 1920s revolutionized condom manufacturing. Latex condoms were thinner, stronger, and had a longer shelf life than rubber ones. This made condoms more accessible, effective, and comfortable, encouraging their widespread use for both pregnancy prevention and STI protection. From a sex health perspective, the evolution of condom materials reflects a growing understanding of barrier methods, importance in reducing infection risk. Today's latex and polyurethane condoms are highly effective at preventing many STDs, including HIV, when used correctly and consistently. They are a key part of safe sex practices recommended by health authorities worldwide. It's important to remember that early condoms provided some protection, but their effectiveness was limited by the materials and manufacturing techniques of their time. Modern condoms undergo rigorous testing for safety and efficacy, making them a vital tool in sexual health. If you have questions about condom use or sexual health, it's always best to consult a healthcare professional for personalized advice.